So hey guys, welcome back to my another video. So here we are with the part 2 of our previous video. In this video we are also going to discuss some of the questions related to COVID. So let's go. Our first question is, what is herd immunity from the coronavirus? Herd immunity is a public health term that refers to the fact that when enough people in a community have immunity from a disease, the community is protected from outbreaks of the disease. So infection disease experts at the Johns Hopkins University explain that about 70% of the population needs to be immune to this coronavirus. Before herd immunity can work, people might be immune from the coronavirus at least for a while if they have already had, but we don't know this yet. A widely available, safe and effective vaccine may not be available for months. Without a vaccine, most doctors and scientists agree that a herd immunity approach of letting the virus take its course is not acceptable. Letting the coronavirus circulate freely among the public would result in the hundreds of the thousands of deaths and millions more people left the lasting lung, heart, brain or kidney damage. Researchers are currently trying to determine if for how long people are immune for the COVID after recovering from COVID. If it turns out that immunity only lasts for a while, people could get COVID again, resulting in even more death and disabilities. Preparing for a spike or second wave of coronavirus in your area. So, doctors, clinics and hospitals recognize that more COVID-19 surges are likely to occur. That's why they are working with manufacturers to stock up on equipment, and they are continuing their policies for protecting patients and staff members. So, here is what you can do. You can continue to practice COVID-19 precautions such as physical distancing, hand washing or mask wearing, and stay in touch with local health authorities who can provide information when COVID-19 cases begin to increase in your city or town. And also make sure your household maintains 2 weeks worth of food, prescriptions, medicines and supplies. Work with your doctor to ensure that everyone in your household, especially children, is up to date on vaccine, including this year flu shot. So, is the second wave coming to an end? Experts believe that at a national level, the wave is waning. The 7-day rolling average of new reported cases during the wave peaked at 392,000 and has been on a steady decline ever since for the past 2 weeks, according to Dr. Video John, a health economist. But there's a catch. Even if the second wave appears to be warning for India as a whole, it is by no means true for all states. It appears have to critics in states such as Maharashtra, Delhi and Chhattisgarh, but is still rising in Tamil Nadu, for example, as in much of the northeast, and situation in Andhra Pradesh and West Bengal is unclear. So the wave is not uniform and there are several states that are yet to find their peak in daily new cases, according to Dr. John. To be sure, infections are coming down in most of the major cities, but the weak rural surveillance complicates the picture, said Dr. Murad Banaji, a mathematician at Middlesex University, London. It is possible that total transmission nationwide has not peaked yet, but this is not visible in case number because the infection is mostly spreading now in rural areas, he said. Such heterogeneity at the local level makes it very difficult to guess whether an India-wide trend of a sharp decline in active cases now is sustainable or not, according to Dr. Sitbara Sinha, a scientist at the Institute of Mathematical Science in Chennai. Brahman Mukherjee, a University of Michigan biostatistician who has been closely tracking the pandemic, agreed. The notion that the peak has passed may give false sense of security to everyone when their states are in fact entering the crisis mode, she said. We must make it clear that no state is safe yet. So that's all for today. Stay safe and stay protected.